So today we're going to be looking at the Headspace agency, looking at the services provided, aims and objectives of the company, and the impact it has on public health, affordability, accessibility, and availability to the public, and looking into the public health principles of the company. Headspace is a government-funded agency with locations situated all across Australia. They deliver youth-friendly and stigma-free services. Headspace is an intervention prevention agency that aims to reduce the burden of disease in young people aged 12 to 25 years caused by mental health disorders and substance abuse. Their target area are particularly vulnerable due to their age, and changes can be made through improvements in their mental health and social well-being. Their vision is for all young Australians to be supported and to be mentally healthy and engaged in their communities. This promotes community health. Headspace's mission is to collaborate to design and deliver innovative ways of working with young people to strengthen their mental health and well-being. By doing this, they are able to build stronger awareness about youth mental health in order to encourage young people with mental health concerns to seek help earlier. They are building the capacity of communities by early detection and intervention in mental health problems, evidence-based interventions for treatment of mental health and substance abuse, and benefit from improvements in access, service integration, and quality. Since 2006, Headspace has helped by providing tailored and holistic mental health support at crucial times, helping young people get back on track and improving their ability to manage their health. The target population of Headspace is young people aged 12 to 25 years who are vulnerable and seeking help to improve their overall health. Headspace services cover 4 key areas, which is mental health and well-being, physical and sexual health, work and study support, and alcohol and other drug services. They provide support for those individuals at risk who are marginalised, like the people a part of the LGBTQI community, Indigenous and Torres Strait Islanders, and young people alike. They aim to provide education and support systems to better promote health. People in the LGBT community make up a large part of Headspace's statistics, and to achieve better health services like peer mentoring, counselling, and guidance from mental health professionals, they seek out the assistance of Headspace. LGBTQI communities are one of the at-risk groups. They are often feeling socially isolated and distanced from their peers for feeling different. Aboriginal and Torres Strait Islanders are located in the priority group, with 9% of them receiving assistance from Headspace. This is a relatively low statistic in comparison to other marginalised groups. This is due to the stigma around mental health. Coming from low socioeconomic areas, mental health literacy is often lower, and therefore they may not be as willing or able to seek the help that they need. Since the inception of Headspace in 2006, they've worked with over 500,000 young Australians to improve and manage their mental health. Headspace has services located all across Australia, metropolitan and rural areas, and are designed to feel different from the traditional clinical services so individuals are more comfortable and at ease, and it allows them an access to an array of health professionals such as GPs, psychologists, counsellors, social workers, and other allied health professionals. These are via appointment only and help link the individual to relevant health specialists. Headspace services are often a first point of contact for those experiencing mental health and substance abuse issues, as they are young people with often no prior existing health issues. Services at Headspace are either free or low cost, and this is covered by Medicare, and are aimed to be low cost so they are accessible and affordable for all young Australians seeking help. eHeadspace is an online and phone counselling service that is available 7 days a week from 9 a.m. to 1 a.m. It allows for individuals to still have access to the services when they may prefer to seek help online or are unable to reach one of the centres. It allows for them to stay anonymous while still seeking the help that they need. Telehealth provides access for those living in rural and remote areas, access to psychiatrists and other health professionals via video consultation. Headspace Schools works with schools by creating programs to educate children and their parents on mental health literacy. Headspace Psychosis supports young people experiencing or are at risk of developing psychosis. Headspace was established in 2006 by the Australian Government and is a non-for-profit organisation. The Department of Health is the principal funding for Headspace services, although state governments are involved. Headspace is considered a health promotion charity and received bipartisan support from the government with the Commonwealth Government funding. State governments create partnerships with Headspace to create programs specific for their state. In Victoria, they have the Victorian Anti-Bullying and Mental Health Initiative, which targets Victorian school-aged children. Public health principles addressed by Headspace is the affordability, accessibility, and acceptability. Headspace is a free, low-cost service to Australians with a Medicare card. Some services will incur a cost, like psychiatrists and psychologists, but this aims to keep it still very affordable for everyone. They aim to be accessible to all Australians by providing access to healthcare professionals like psychologists and psychiatrists and social workers to Australians who may not have access to these health professionals normally. They serve as a first point of contact to those seeking help for their mental health. They work to drive community engagement and awareness raising and research and evaluation and translating it into practice. They are inclusive and welcoming of all people by specifically stating on their website that they recognise the traditional owners of the land, and they do create services aimed at helping the LGBTQI community and the Aboriginal community. Equality is achieved by creating access to and programs to all Australians seeking help for their mental health. This mental health framework provides context to those looking to improve their mental health and social well-being. They work with the clinical government's framework to achieve excellence, improve quality, and errors made in the delivery of healthcare to young people. They achieve this by supporting organisational clinical government systems, quality care, definition, goals and objectives, strategies and measures, and by staff knowledge, skills, and behaviour. Social justice is achieved by creating equity to access to these services via online, in-person, and telehealth. It creates justice for marginalised people in society, such as the Aboriginal and Torres Strait Islanders and the LGBTQI community. Empowerment is then achieved by increasing the power of the disadvantaged by creating target programs and services to increase their health. The social determinants of health are addressed by Headspace by creating programs tailored to communities in certain areas and improve their well-being. Headspace provides social support to those in need. This is done by counselling, reaching out, creating safe spaces, and being non-judgmental in their approach to improving their mental health. Headspace helps those facing addiction and substance abuse with programs and healthcare specialists trained in that specific area. They help manage the stress of young individuals, which boosts their mental health as they receive knowledge in health-promoting behaviour. Headspace works as a primary health network providing mental health services and drug and alcohol services. Headspace addresses the socio-ecologic factors of health beginning with the individual themselves. They build interpersonal relationships through the use of health professionals, counselling and peer counselling. They work with organisations such as schools and workplaces. They address the community by partnering with well-known organisations, and in the case of Headspace, they partner with places like Kmart and sporting teams like the GWS Giants. This then addresses the public policy through national objectives to improve health, like providing support to schools affected by suicide and early psychosis programs. Headspace addresses health at the primary care as it provides interventions to help improve health with the most individuals at the lowest cost. They are comprised of primary healthcare workers like GPs and allied health professionals and are a government-level institution. Health promotion is addressed at Headspace by allowing people to increase control over and improve their health. This is done by providing mental health literacy to young people and their families, being an intervention and providing support for suicides and substance abuse. This improves an individual's overall health status and improves and enhances their quality of life. They create supportive environments for those at risk and improves advocacy by providing an easily accessible service to improve health for the individual and the community, and programs to elicit change and healthy behaviours. Some limitations of Headspace, while they do have locations all across Australia, is a lack of access to mental health professionals for those living in rural and remote areas. This is addressed by the lack of allied health professionals in these areas, and as a result, an increased use of telehealth and e-Headspace services. While although helpful, telehealth may not provide the same level of support as an in-person visit would. Recommendations would be to increase the number of staff, especially those in rural and remote areas, to improve access for all those seeking healthcare. They should also partner with local governments to promote positive health behaviours at a community level to promote health and advocate for mental health for all. Thanks so much for listening today as I tried to educate you on public health principles relating to the Headspace company. I've attached a short video highlighting Headspace's services aimed at providing help to young people during these scary and confusing times. Thanks again, and hopefully you can check out the video.